and thank you for watching this presentation. My name is Giulia PERASSO. I am a psychologist and I have a PhD in psychology, neuroscience and data science. I am currently working as a research project consultant at PORTO di PICCOLI, a non-profit association that is located in Genoa, Italy, and that since 2005 is promoting to practice and experience in the field of healthcare the professionalism of the play specialist. The play specialist in our country has not been recognized yet, but we are making some progress in this direction, given the dialogue with international stakeholders and exchange of evidence from research and best practice. Today I will depict the state of the art around the play specialist professionalism and highlighting evidence from research, motivations why the play specialist should be integrated in the international and national healthcare system as a sanitary profession, and also the issues in this process, and also some hints about the training and the formation of these professionals. So let's begin. Probably you all know that play is a fundamental right during childhood, but according to the European Association for Children in Hospital, it becomes even more important when the child or the adolescent is hospitalized. Hospitalization is a disruption of the familiar routine, and it can cause stress and severe anxiety. So play can be a mean to counteract these negative emotions and to make the hospital more friendly or even more enjoyable for the child. The basis of play and the application of play for hospitalized children come from the psychological sciences that think, for example, about development psychology and the idea that play is a fundamental monitoring tool to observe if a child has reached the developmental milestones in the cognitive, emotional, moral, and social fields, and to monitor if he or she is having a healthy development. And it's also a promoter of change in psychotherapeutic pathways. So play has a long tradition of importance and of evidence. And so let me say, play should be taken seriously and not only seen as something childish. Play specialist. Who is a play specialist? We will see a little later that is someone that is administered with a specific training, and normally he or she has a background in psychology or pedagogical sciences, and in most cases a bachelor degree in these sciences. We have to pay attention to not confound the play specialist with the play therapist. Play therapy is a psychoanalytical approach that uses play to lead individuals to express their inner selves and hidden emotions. Play specialist does something different, and we will see it in a moment. Let's also say that play specialist is a label to encompass many synonyms that since the 20th century have been used all over the world. The first pioneering labels to describe this professionalism, driven from the intuitions of Florence Nightingale and Frederick Harrison, first nurses trying to systemize the place practice in the hospital are, for example, puppet lady, play lady, recreational therapist. Now we are using many other labels, for example, certified child life specialist in northern United States and in Canada, health play specialist, healthcare play specialist in the United Kingdom, and other many synonyms all over the world. Play specialist is a label that we are here using to encompass all those differences, to build a common ground, to build a dialogue for enhancing these professionals and to give them more recognition from institutions. So, what does a play specialist do? There are two main core activities. I am really summarizing here. Medical play. Medical play is a term used to encompass all those activities that a play specialist does to help the children familiarizing himself or herself with the medical environment, medical equipment, doctor, nurses, surgical operation, and medical tools. For example, he can or she can structure play programs based on the age and on the specific diagnosis of the children to counteract the fear of needles. And on the other hand, there is normative play. Normative play is a term used to encompass all those activities that are used to give the child a sense of a continuation with life before illness, or to provide him or her with distraction from pain and from the anxiety for medical procedures. The general aim is to make the hospital more friendly, as I said before, but also to make the hospital more understandable and to help the child to familiarize with concepts about like health, like cure, like being sick, being healthy, and what are the consequences of these different states and experiences. What does literature say? Literature says that the play specialist intervention can improve coping strategies of children, making them stronger in facing this kind of experience. It can reduce the anxiety and stress level related to the hospitalization. It can make the child more cooperative with the medical staff, with major adherence to treatment. And the last point, I think, is also very important. When a child is hospitalized, he or she loses a lot of his or her previous self-efficacy. That is really important for the younger individuals that are growing. When a child enters the medical setting, the hospital context, he or she is deprived from the possibility to decide about his or her destiny. And of course, child are a responsibility of parents. But in this context, they can experience a real power imbalance. Adults seem to decide everything about them, about their health, about the cure they have to make, and this can make the child rebellious. And so someone supporting the child with specific programs can really be helpful to diminish this sense of weakness. And summing up, what are the main reasons why the play specialists should be integrated in the healthcare? Improving the child well-being, of course, improving the child coping strategies and pain management strategies, making the child more adherent to treatment, and also helping the child and the family in the oncological care. And also it leads to spare of costs and spare of time for the medical staff, because if the child is more cooperative, it needs less sedation. This point is really, really important and highlighted by literature. But what are the issues in the process of make the specialist a part of the hospital staff, of the healthcare? It is the lack of standardized and internationally shared methods and measures, the lack of recognition from institutions, the lack of communication, effective communication with the hospital staff, and the risk to overlap roles with the nurses or doctors that may play without the proper background with their little patients. And there have been also many problems arising from the pandemic. For example, in Italy, the specialists, given the restrictions related to pandemic, were excluded from the access to hospitals, leaving many families deprived from their support. So we have to readapt our approach in the telematic environment, and this has been quite challenging for our professionals. Let's talk a little also about the training. According to a survey conducted on other stakeholders from all over the world, as I was saying, the main prerequisite to become a play specialist is to have a bachelor degree in psychology or pedagogical sciences. It's also really important to do practice in the field with internship in pediatric care, and in some countries the training leads to a register for these professions, to register their names as a category, to also support the category and advocate its right and its tasks. And the main stakeholders all over the world report a minimum of hours for training that is 200 of hours to a maximum of 760 hours. The main studied subjects are child development, child pathology, family dynamics, and specific play techniques. To conclude, what are the future directions for this professionalism? Struggling to obtain more recognition from institutions, creating a common ground for practice and research, implementing the core activities and the strategies that are characterizing this professionalism. Avoiding overlapping with other professionals, for example, pet therapists, and also to get a major integration in this historical period in the healthcare, because play specialists can really make the difference. For example, let's think about vaccination, how they could be useful in helping children to fear less the needles in children's anti-COVID vaccinations. This should be an innovative field also for research and for collecting evidence about the benefits of this approach. So I have finished. I am thanking you for being here, for watching this presentation. I'm also thanking you, my general manager and all my colleagues from Porto dei Piccoli, and also the scientific committee and the management committee of our association, and also all the stakeholders from all over the world that are exchanging best practice and research with us. Thank you so much.